This week, CMPD officers saved the life of someone who was having a mental health crisis. This video here shows the officers talking the person through that situation.
Yeah, a scary scene, but CMPD says this is what their officers are trained to do and are ready for any given day. WCNC Charlotte's Austin Walker walking us through the life-saving training and why the conversation around mental health is just so important.
This video from Tuesday shows a man in crisis, contemplating to jump off a bridge onto I-77 in Charlotte.
Unfortunately, a lot of times we meet people on their worst day.
CMPD arriving on scene, and after intervention, the man stepping back safely onto the road and getting help.
The first officers that responded, they did an extraordinary job.
Captain Matthew Horner with CMPD says aside from the tools learned in the police academy, mental health training is also stressed.
De-escalation is one of those things that when we can do it, we will absolutely do it.
CMPD says officers go through a minimum of 40 hours of crisis intervention training. Now, this is where officers learn de-escalation tactics as well as signs to look for if someone's having a mental health crisis.
They have role players come in, they have all different kinds of scenarios, and they put you through the reps of kind of learning how to deal with, again, different levels of crisis and different types of interactions with people.
They're often the people who end up on the front line of situations like this.
Katie Durkee, Marketing and Outreach Coordinator with the National Alliance on Mental Illness, says the life-saving training is critical for anyone.
Somebody in a mental health crisis can also look like somebody in a diabetic crisis, can also look like somebody who is dealing with addiction.
Data shows suicidal thoughts among people are on the rise. According to the CDC, in 2021, suicide was the second leading cause of death for people ages 10 to 14 and 20 to 34. Durkee says there's a first step to finding a solution.
The more we talk about suicide, the more likely we are to prevent a suicide. And actually the recommendation from everybody who works within this world of mental health and suicide prevention will tell you that having those honest conversations is going to be the best way to stop somebody from ending their lives.
She says the stigma around suicide makes it difficult to talk about, and at times people are discouraged from talking about it.
If I'm just used to talking about that, this one doesn't seem as scary and as high stakes and as so hard to have.
Hoping that with an open conversation and ample amounts of knowledge.
Mental health is one of those medical conditions that people don't really like to talk about.
The data behind death by suicide trends in the other direction. In Charlotte, Austin Walker, WCNC Charlotte.
And of course, we can't talk about this story without reminding you, if you or someone you know is struggling, you're not alone. There are resources and there's guidance out there to help you through this tough time. First, there's the National Suicide Prevention Hotline with that phone number 988. That's available 24/7 for anyone in crisis, and it is free. And there are plenty of local resources too, other agencies offering help. And some of these are even tailored towards specific groups like veterans, members of the LGBTQ community, mothers, and many more. You see a few on your screen right there. And we have this list available right now on our website and inside our mobile app too. Don't forget, we're marking Suicide Prevention Awareness Month with a town hall aiming to seek solutions to this growing crisis. You can watch that live on WCNC Plus, WCNC.com, and on the WCNC Charlotte YouTube channel. It's happening Tuesday, September 26th at 12:30.